Well, I think like most dentists, I do a bottom layer and then a cap layer. And condensing with a traditional condensing instrument is frustrating because you always feel like the composite's moving not where you want it, and you're not sure if you're actually getting a dense layer, and you're worried that you're going to incorporate voids and bubbles. Whereas with the C-shape it's just so easy. It just really feels like you're pushing the composite down into the prep thoroughly and creating a dense layer. And I don't have that problem if every time I move the instrument, I push it in one direction and pull it in the other. So it's really just made it much, much easier. Using it, really what I see is easier to fill. It takes me less time. It's less frustrating, and really nice dense fills on a radiograph. So I don't worry anymore about that, taking an x-ray and having my composites look like Swiss cheese, because there's these little air bubbles, and then you're trying to figure out, are they at the margin? Where are they? Do I have to replace this composite? So super dense fills. The whole thing surprised me, because truthfully, when you look at this instrument, you're thinking, I don't get it. Like, how is this going to work? Because it looks totally different than what we're accustomed to. We're accustomed to using traditional condensers. And it just, the size of it, you're thinking, how is this ever going to work? It's bigger than what I'm trying to fill. And that's actually the magic. So, the size of it, which allows it not to go down into the composite, so that when you pull it up, you don't get sucked back like with a regular condenser. And the flexibility of the tip is what allows you to put really firm pressure, get those great dense fills, and it also at the same time cleans up all the excess on the occlusal table. So it also means I have less time when I go to trim after the composite's cured. But I will tell you, everything about it surprised me. And I would just tell you, when you look at it, don't judge it by its first appearance. You got to get it in your hands. You got to use it clinically, and you'll fall in love with it. So, the other side of the C-shape, so one side kind of looks like a big silicone ball. The other side looks like sort of a flat silicone shovel. And again, for me, when I work in the anterior, what I'm trying to do is not condense composite. I actually want to sculpt composite or move composite around and be able to shape that. And that really does that. One of the things about the instrument is it's not sticky. So most of our composite instruments stick to the material, and when you lift the instrument, it pulls the composite back off the tooth or the prep. And this instrument doesn't do that. It's completely non-sticky or non-tacky. So it makes shaping the composite really easy and beautiful. Oh my gosh, it exceeded all of my expectations. I use it every time I place a composite. Wouldn't not have it on my instrument setup. And the other thing that is just really great is that the tips are disposable. So instead of having to worry about managing those instruments, getting composite off of them, having composite go through the ultrasonic or the autoclave, I love the fact that you just take the tips, throw them away, autoclave the handle, and you're good to go with a fresh start the next time.